Bottle PEP is an oscillating positive expiratory pressure device used for sputum retention and improving the ventilation of the lungs. It is a simple and cheap method of administering low-pressure PEP therapy, particularly in the acute and rural settings. It should be prescribed by a healthcare professional trained in the use of this device and can only be used by people who are cognitively able to use the device correctly. The device can easily be made. Any large bottle can be used. In the hospital setting, a 1 litre water for irrigation bottle is ideal. Clearly label the bottle as a PEP device. A length of plastic tubing, preferably suction tubing, with a diameter of greater than 8 mm is required. This ensures that the PEP pressure is independent of the tubing length and flow rate. The PEP pressure is therefore only generated by the height of the water and not influenced by the length of the tubing and expiratory flow. The tubing of approximately 20 to 30 centimetres needs to be long enough to sit near the bottom of the bottle and comfortably reach the mouth in an upright position. At home, a 2 litre plastic container can be useful as the tubing can be fed through the handle, which helps to keep it in place. Positive expiratory pressure and oscillations within the chest are created by blowing through the tube into the column of water. Fill the bottle to between 5 and 10 centimetres depending on the clinical symptoms and the pressure and oscillations required. The deeper the water, the greater the pressure. The lower the height of the water, the greater the oscillations. The top of the bottle must never be sealed to ensure safe, positive expiratory pressures. If bronchodilators have been prescribed, administer them before commencing treatment with this device. Sit with the arms supported with a neutral lumbar spine and the shoulders and neck relaxed. To assess the positive expiratory pressures produced, a manometer can be placed in the tubing. This is important if high pressures are contraindicated. It is also a very helpful teaching tool. Breathe in slowly, preferably through the nose, a little more than normal, and hold the breath for 2 to 3 seconds. If it is necessary to breathe in through the mouth, make sure that the lips are removed from the tubing. Seal the lips around the tubing and breathe out actively, but not forcefully, through the tubing to create bubbles in the water. If a manometer is attached, the pressure should reach approximately 10 to 20 centimetres of water pressure. Repeat for 5 to 10 breaths. Relax and breathe quietly. This is 1 cycle. The physiotherapist will prescribe the number of breaths and cycles. When using this device for airway clearance, huff as instructed by the physiotherapist, either at the end of each cycle or at the completion of all of the cycles. This should be individualised to the patient's needs and will depend on the amount of sputum in the lungs. For sputum clearance, bottle PEP is generally prescribed for up to 10 cycles of up to 10 breaths, using 8 to 10 centimetres water twice a day. For people with low lung volumes or shortness of breath, the prescription can be reduced. At the end of the session, dismantle the device and wash all of the parts in warm soapy water. Where it is not appropriate to make a bottle PEP device, a TheraBubble device can be purchased. The patient should be given written instructions, including the technique, prescription, and cleaning of the device.